Our goal is to get you home to recover as soon as possible, but only when it's safe for you to do so. Our case management team will work with you and your care team on discharge planning. Here's more information about discharge planning. The case management team will work with physical therapy, nursing, and your physician to assure that you have a safe plan for discharge. Their preferred discharge is for you to return to your home as soon as possible. In order for this to happen, there are requirements. You have to be able to get up and out of bed with minimal assistance. You need to be able to get back and forth from the toilet and to your favorite chair. You'll need to be able to walk a reasonable distance with increasing endurance. They prefer that you have someone staying with you to help you after your surgery for at least the first week after you have been discharged home. So please make arrangements prior to your surgery to have someone stay with you and help you afterwards for at least a week. If you cannot do one or more of these things, case management may recommend a short stay in a rehab facility until you are able to be safe at home. Most of the surgeons would prefer that you go home after the surgery, so if you're not able to meet the requirements for discharge, but might be able to do so in another day or two, then you may be kept in the hospital to meet those goals so you can go home. If not, a case manager will talk with you about making care arrangements. They may be able to have a home nurse or home physical therapist assist you to facilitate you going home instead of to a skilled nursing facility. Your case manager will also assist in coordinating any additional equipment you may need prior to your discharge. If you have any concerns regarding discharge and needs after hospitalization, a case manager is available to you. As you've just heard, our goal is to get you home to recover as soon as you can safely do so. We'll make sure that you can get in and out of bed with minimal assistance, get in and out of the bathroom or the chair by yourself, and you're able to walk a reasonable distance. We want to know that you can go to your kitchen and make yourself a snack, or if there is an emergency in your house, like a fire, that you are able to get out of the house safely. One way we can achieve these milestones in the hospital is by encouraging you to walk a full loop on the patient floor. That's about 360 feet. And again, you should have someone to assist you in your home, especially at night. For the first 5 days after surgery, though, you shouldn't need 24/7 attention. Let me cover a few other things that are important to know about after surgery. First, during surgery and sometimes the day after surgery, you will be receiving fluids by IV. About day 3 or 4, patients notice that they are slightly puffy or swollen all around their body. Typically, when you are at home and up and walking around, gravity pulls that extra fluid into your ankles and your feet. If this happens, I recommend laying on a firm couch or bed and elevating your knees and your feet higher than your heart. A good way to do this is by placing pillows the long way underneath your knees and feet. Do this 2 or 3 times a day and it will help decrease some of that swelling. Many patients also notice that they urinate more frequently after surgery. This is normal as your body gets rid of that extra fluid that you were given during surgery. If your urine is cloudy, concentrated, or foul smelling, please call your surgeon's office. When you are discharged home, you will not have any outpatient physical therapy right away. Your only physical therapy is to get up and walk around every hour during the day when you are awake. It does not have to be much. Go to the kitchen or the bathroom. Do some loops around the living room. Do some type of walking for about 5 minutes out of every hour. As you progress and feel better, you can go for longer walks on level, flat ground. When you feel ready to venture out of the house, make sure to go someplace that you can sit down and rest when you're tired. The mall is a good example because it has lots of available seating. Remember, for a few weeks after surgery, you're going to be very tired and easily fatigued. The hardest part for weeks after surgery will be getting in and out of bed and in and out of chairs. Make sure that you listen to your body and to get rest when you feel tired or fatigued.